happen to be a therapist at this time, there's no doubt that you're being inundated with information about ketamine-assisted therapies or other therapies that use some sort of drug to accelerate the process of working through trauma. And I'm not sitting here really with any opinion on those interventions at all. And if the research supports what they're saying, I think, great. I actually literally know very, very little about it. What I do know is that I'm a sober therapist, and my knee-jerk reaction has been to protect myself and stay as far away from this discourse as possible. I also know I felt like a certain amount of peer pressure around this in a way that doesn't feel healthy to me as somebody who's sober, or somebody who's a therapist. It feels like there's something driving this in a way that doesn't feel totally okay to me. And also I'm holding in mind at all times clients of mine who are in recovery or have dealt with addiction, and thinking about how this promise of relief from trauma being intertwined with them possibly losing their sobriety is a pretty complicated equation. And so I'm just making this video literally to hold space and acknowledge sober therapists and therapists who are trying to keep clients sober, and knowing that there's this big, huge idea and movement out there that's telling us that this might be the thing that really turns trauma around, and that sitting with the complexity of all of this at this moment in time, there's nothing simple about it.